The main treatment in pregnancy and outside of pregnancy are going to be your carbonic anhydrase inhibitors. That's going to be acetazolamide or Diamox. If you have IIH, I know that you've heard of this drug. We prescribe it in divided doses of 1 milligram. So you may be on 0.5 milligrams twice a day, or you may be on 0.5 milligrams 3 times a day, or up to 2 grams over several doses. Usually once we're getting up to 2 grams, if that's not working, then we're usually trying something else. Acetazolamide is going to function by decreasing the cerebral spinal fluid production, okay? And so if your body is not churning out as much cerebral spinal fluid, the theory is you won't have as much pressure on the brain and the spinal cord. So then you won't have as much papilledema or pressure on your optic nerve, and then you won't have as many headaches. So Diamox is used pretty commonly to treat IIH in and out of pregnancy. Some people may also need pain medication. I do not recommend pain medicine as first line, which is why I did not put it on this slide. People that have migraines that are not thought to be IIH may be on pain medication like a Norco or a Percocet. But in pregnancy, we don't want to use those things long term, because babies that are born to moms that are on long-term narcotics can have an increased risk of what's called neonatal abstinence syndrome or symptoms of withdrawal from that narcotic. And so if we have to use pain medicines, I ask my patients to use it sparingly, like only as needed. Will you take Percocet or Norco on top of your Diamox? Because if your Diamox isn't working, that means that we need to increase the dose of that Diamox, or we need to do something else. If a patient has rapidly progressing vision loss, but doesn't have really a lot of headache, then optic nerve fenestration is what needs to happen as a surgical treatment of choice. You can do optic nerve fenestration if you need to in pregnancy. And ACOG, or the American College of OBGYNs, actually recommends this treatment modality over diversion surgeries, which I'll talk about in a second. But you can have optic nerve fenestration in pregnancy, because what we don't want to do is not treat you and then you have some permanent vision loss there, okay? And so in order to know this, your OBGYN would be needing to co-manage you with a neurologist, so that your neurologist will be monitoring your a neurologist and or an ophthalmologist will be monitoring you for signs of papilledema and nerve damage, and your ophthalmologist will be looking at the retina, monitoring for signs of increased intraocular pressure to know, hey, you're having more vision loss. We're seeing that your visual field acuity is decreasing. Maybe you need an optic nerve sheath fenestration. This is extremely rare in pregnancy. I've actually only had 2 patients that have needed optic nerve sheath fenestration during the pregnancy. The majority of people can be treated with just acetazolamide and Diamox alone. Now, with patients with vision loss, papilledema, and a headache that don't respond to medical therapy, like we've done Diamox, we've increased the doses of Diamox, we've also given you intermittent narcotics, that's not working, then a CSF diversion procedure is the preferred treatment. But this is only if absolutely necessary, because this is like a shunt, right? So we're placing a shunt, or a neurosurgery is placing a shunt, which then goes in the abdomen. Cerebral spinal fluid then drains into the abdomen. Well, obviously, we don't want to do anything abdominally that can, interfere with the pregnancy. Obviously, the shunt's not going into the uterus, and obviously we don't have to make an incision on your uterus or interrupt the pregnancy. But anytime we have an abdominal surgery, that can potentially cause palpation of the uterus or manipulation of the uterus, which can then cause contractions, which can put somebody at increased risk of going into preterm labor. So that's why we don't do the CSF diversion procedure unless you absolutely need it, right? because we don't want permanent vision loss. And so we absolutely need it. Patients can get that. But like I say, most patients respond very well to Diamox if they continue it during their pregnancy.